And as a recruiter yourself,
No, I have no client, no contracts, all the business.
well, then you shouldn't have any trouble if I'll sign a pledge
No,
saying that
so-
you won't contact, you won't have direct contact with your former clients.
So okay, are you making the same request of Senator Dayton?
I have no idea.
Okay, let's do this. I'll tell you what, I'd be happy to sign this. Let's make it all candidates that they make sure that they're all disclosing their interests and that they've all divorced themselves from conflicts of interest. So once everybody steps up to that same level of responsibility that I have, where I've disclosed all of my clients, I've divorced myself from all business interests, because I think we do deserve it. I think that is important. So I agree with you. So here's what I would ask of you. Let's make sure that people at least get candidates, at least get up to the level that I'm at right now, and then we can talk about going to the next step.
So you really believe nurses are greedy and irresponsible?
I've never said that.
That was the campaign.
No.
Yes, it was.
No, I've never said that. No communication. You'll never find any communications that came from me, that came from my office, that came from any work that I've done, that have ever called the nurses that. And so if you're going to make that accusation, then you have to put the evidence before people so that we're not...
You were the person that was hired by the hospitals to run their campaign.
I consulted with the hospitals to help them communicate to the public about what's going to happen, about how services would be available. As you know, I wasn't involved in contract negotiation, and it was never any inflammatory language, any language other than the highest respect that came out of anything I had regarding nursing. Because I have nothing but the highest respect for nurses. And so before you make those accusations, you have to show the public where those came from me, and I really don't think you can do that. So I would appreciate...
But you were comfortable working with a company that made those kinds of statements?
No, our company never made those statements.
I said, were you working with the hospital association who was making those statements?
I can't speak for the hospital association.
Well,
we were not working with the hospital association. We were working with a group of hospitals. That's true. And the communications we did always were very respectful of everybody involved in the negotiations and of the community. And what we did was help the community understand what services were going to be available, how a potential work stoppage might affect their care. I think those are reasonable things for the community to understand.
especially as it would be that would be
Well, so again, here's what I would challenge you to do is before you make those accusations about me, then you have to show where I made those statements.
And if you do that, you're going to sign this pledge?
If you present the same pledge to Senator Dayton and Tom Emmer and get them to step up to at least the level I'm at right now. I mean, they haven't disclosed anything. They haven't severed any business ties. You have no idea whether they're working for any potential conflict of interest or whether they're getting revenue from any potential conflict of interest. What you know about me is I have no revenue from any interest, period.
You know that Mark Dayton is supporting the nurses. And so that
but I think that really is the issue here, right? So what we don't know about Senator Dayton, though, is what other conflicts do we have? Because I think we all agree that there are a lot of issues. Hospitals are important, healthcare is important, nursing is important, but so is education, so is job opportunities, so is tax reform, all of those issues. And I think it's only fair then that if you're going to ask me to go even further than I've already gone, that you ask Senator Dayton to at least get up to where I am, that you ask Representative Emmer to at least get up to where I am. And that you don't make misleading and untrue statements about me unless you can document them. I would appreciate that. Because I do think, pardon?
we'll be working on that.
I appreciate that.
That's
Because
what we want. That's what we want.
absolutely. Because I do think that we ought to have a conversation in this campaign that really talks respectfully about everybody, that talks about the important issues, that focuses on solutions.
Would you be willing to meet with the nurses at a meeting?
I've offered that many times. Absolutely. I would be delighted to do that. I think that would be great to have that kind of conversation.
I'm not sure we could get too many nurses to do it.
Well, see, that would be unfortunate, I think, because I think we ought to have that dialogue, and I have stepped up. I have had conversations with a number of union members in different settings. I believe strongly in the right to organize. I believe strongly in the right of organized labor to represent workers. I think that's important. I've always been respectful of organized labor.
What do you think about ratios for patient care?
I think that we need to make sure that we're doing all of the right kinds of things so that we can provide safe, affordable care in hospitals. I don't think that it is government's role to get involved in dictating specific levels of management. And I understand that we'll disagree in terms of policy. It doesn't make me wrong. It doesn't make me a bad person. It just says we disagree on that, as do a number of people, as do a number of healthcare experts. Even some of your own members disagree with that. The evidence is at best inclusive that mandatory staffing works. And in many cases, in California, for example, the evidence seems to suggest that it actually does add costs without enhancing safety. And so I think we do need to be concerned with safety.
That would be an inaccurate statement.
Well, but that's been reported in the newspapers, and so I'll certainly be happy to provide the quotes.
Right. If the legislature passes this patient ratio legislation and it comes to your desk and you're the governor, will you sign it?
Depends what the legislation is.
Okay, thank you.
You're welcome. Thank you for coming. Thank you. Hey. Hi, Christy.
Let's hear somebody, could interview.
Thanks for coming.
I have a bunch here in mind. Can they talk to you?
Oh, thank you very much.
Handled that very well.
Thank you.
My name is. Do you have the document that you want?
Yeah.
It's going.